ECDC On Air,
the podcast of the European Centre for Disease Prevention and Control.
Keeping up to date with European epidemiology.
Hello, welcome, and thanks for tuning in to ECDC On Air, the podcast of the European Centre for Disease Prevention and Control. I'm your host Lee, recording from our headquarters in Stockholm, Sweden. On today's episode, we're discussing the 2030 Sustainable Development Goals with ECDC expert in communicable diseases, Charlotte Deogan. The 2030 Sustainable Development Goals represent a universal call to address a wide range of interconnected global challenges. Goal 3 specifically focuses on health and well-being. ECDC works to support countries to reach Target 3.3, which aims to end the epidemics of HIV/AIDS, tuberculosis, viral hepatitis, and other communicable diseases. So we're sitting here today with Charlotte Deogan, expert in communicable diseases here at ECDC. Charlotte, thanks for joining us.
Thanks for having me.
Before we begin, could you tell us a little bit about your role here at ECDC?
I work in the group we call it SDG diseases group, which work with HIV, tuberculosis, viral hepatitis, and STIs. And I work mainly on prevention and monitoring.
So today we're going to be talking about the newly released monitoring report on the Sustainable Development Goals. Could you give us a brief overview of what the SDGs are and specifically what is SDG 3.3?
So the agenda for the Sustainable Development Goals is a joint plan for the world's countries to work towards a better future. So the foundation are 17 Sustainable Development Goals, of which one is number 3 on good health and well-being. And then there are several other ones, one on ending poverty, one on achieving zero hunger, etc. And what's essential about these goals is that they recognize that ending poverty goes hand in hand with, for example, strategies on improving health or improving education, ending inequality, and spur economic growth, all the while tackling climate change. So preserving environment, nature, oceans, and forests. And that's in difference to what we had in place before, the Millennium Development Goals. That's new. It's more integrated and system-wide approach to achieve sustainable development.
Okay, so ECDC, as I mentioned, is releasing its first monitoring report tracking the progress towards SDG 3.3. And so that's going to hit the targets for HIV, TB, viral hepatitis, and STIs in Europe. Why is this report significant, and what's the plan for monitoring the progress that we'd like to see in Europe over the next few years?
Well, this year, 2025, is the interim year for these targets. So we have 5 years to go to reach the targets. So this report is a great overview of some of the outcomes and some of the country responses in terms of these diseases. And we focus on 5 different areas: incidence, prevention, testing and treatment, and mortality. So it gives us a pretty good reference point of the status as for now on these diseases, and helps us take stock of the achievements made and identify some gaps in terms of where we should go from here, to identify priorities going forward.
Okay, so looking at the big picture of these diseases, what is the general story? Are we on track to meet the targets, or are we a little bit behind?
There is significant progress in the EU EEA on these targets. The progress varies a lot depending on the country as well as for the disease, of course. But we are on track in terms of progress towards HIV testing, HIV treatment, as well as detection of TB. And then we're not on track in the EU EEA on a range of other indicators, for example, TB treatment, prevention efforts, and mortality targets.
Okay, so moving into the diseases, the specific diseases, let's talk first about HIV. So how does the progress that has been made so far measure up to the targets that have been set? I mean, are we seeing equal success in testing and treatment across Europe?
So for HIV, we have really good data. So we are able to assess the progress in a good way. the progress is not equal across the region. There are lots of disparities in terms of access to testing and treatment. But in general, the estimated HIV incidence has declined over time since 2010, but it's not been aligned with the target of 2025, so it's not been fast enough. In terms of testing and treatment, we are on track. We are within 5% reach of the targets that were set, so that's very encouraging. But of course, that means that that's the EU-EEA average. So some countries reached the targets or even exceeded them. Some are within 5% reach, and then some remain below the 5% reach, meaning they're not on track to meet targets. And then we still have quite a remaining challenge in terms of HIV to, of course, reach the ones that are undiagnosed with testing and then link them to care. And especially for key populations and vulnerable populations where we see that there are still very much barriers to accessing testing and treatment. And in some settings of Europe, we need to remove those barriers to effectively reach them and test, treat, and link to care.
So one of the things in the report that gets mentioned when it comes to HIV is pre-exposure prophylaxis, or PrEP, as an important tool for HIV prevention. Could you explain a little bit about what that is and how widely it's being used, and whether this is really something that needs to be focused on to be able to hit these targets in the next 5 years?
Yeah, so pre-exposure prophylaxis, or PrEP, for HIV is a antiretroviral medication for people who do not have HIV to reduce the risk of acquiring HIV. And it's a really effective prevention tool and a key element in the HIV response in Europe. And there have been quite significant progress in expanding the availability of PrEP and increasing the uptake. But there's still a lot of room for improvement on the number of people on PrEP in Europe. So we're not reached the target, and we're very far from reaching it. As for now, we have a problem with the equity in the delivery of PrEP. So for now, the main group using PrEP is men who have sex with men. They're high risk of HIV and STIs. But we need to expand the delivery of PrEP to other groups that could benefit from using it.
Turning towards TB, do you think we'll meet the 2030 target? It seems that ensuring successful treatment seems quite challenging. And can you elaborate on why that is?
Yeah, indeed, the treatment success rate of TB is low in Europe. It's at 68%, and that's substantially lower than the global target set by the WHO to successfully treat 90% of patients. A difficulty in succeeding is that there might be some delay in diagnosis. We might have difficulty in adherence to treatment, and keeping patients in treatment long enough to complete treatment is also a challenge. A difficulty is also multi-drug resistant TB, which is very concerning. The treatment success rate for that group is even lower. And there are additional challenges in managing multi-drug resistant strains, including insufficient access to the right medicines.
So one of the things that seems quite curious is that hepatitis B and C cause quite a significant number of deaths in Europe, even more than HIV/AIDS or AIDS-related causes and TB combined. Why is progress seemingly slower here, and what are the main hurdles?
Yes, indeed. So the disease burden of hepatitis B and C, as well as the number of deaths, are quite high in Europe and is not declining. We have estimates of 3.2 million people living with HBV in EU-EEA and about almost 2 million living with HCV. So that's huge numbers. The progress in terms of testing and treatment is not that easy to assess because of the data limitations that we have. But the information that we have do indicate that there are significant shortfalls in meeting the testing and treatment targets. What does that mean? It means that too few people are getting diagnosed and treated on time. And of course, these are infections that you can get infected by without knowing it. You can live with it without knowing you have it for quite some time, which spurs on, of course, these high numbers in deaths because of the complications on liver disease and liver cancers. So we have remaining high mortality in Europe for these diseases.
Moving on to sexually transmitted infections or STIs. So diseases like gonorrhea and syphilis, the incidence rates of these are increasing. What's driving this trend and what can be done to reverse it?
Yes, syphilis and gonorrhea are increasing, and there are some hypotheses to why this could be. One of them is that STI testing has increased. So if we test more, we find more cases. That could account for some of the increase. We test more in certain populations. For example, people that are on HIV PrEP, they get regularly screened for STIs, which could account for some of the increase. Another part could be changes in sexual risk behavior. So lower condom use, increased number of sexual partners could be one. The increase is more prominent among young people, and there are some survey data indicating that the condom use has decreased among young people and adolescents, so that could be part of it. But these are hypotheses that need to be further studied before we can be certain of that.
A recurring theme in the report seems to be there's a lack of data for certain things, particularly for, say, hepatitis and STIs. Why are these gaps concerning? How can we improve data collection to better track our progress towards the SDGs?
Yeah, I mean, the data gaps are concerning due to the simple fact that then we lack the insights to guide and inform our public health decision making and how we can target testing and treatment. So we need to know how many people are getting tested out of the ones that need to be tested and how many of those are getting treated in order to know the part that are not getting what they need. So that's absolutely a priority to generate data on that. And we work with countries to support them in generating new data and to improving the surveillance and monitoring data that we need in order to assess the progress towards the goals.
It seems like these diseases seem to affect key populations more than others. For instance, men who have sex with men, migrants, people who inject drugs. How important is it to tailor prevention, testing, and treatment efforts towards these specific populations effectively?
The simple answer is that it's really very important. It's vital. Providing like a blanket or general availability of testing is not efficient. We need to tailor and target services according to the needs of the population we want to reach. For TB, for example, this would mean to use a people-centered approach that support individuals or patients through the care pathway to initiate testing, to get diagnosed, to link them to care and to retain and support them through completion of successful treatment. For HIV and hepatitis, as well as for TB, we recommend a migrant-sensitive approach, for example, which means that we adapt prevention, testing, and treatment to the group with language and cultural mediation, for example, to make these services accessible, acceptable, and affordable to the groups that we want to reach.
Okay, finally, based on this first assessment, what should be the top priorities within the EU EEA to end these epidemics by 2030?
Yeah, that's the key question. The top priorities would be to strengthen efforts on prevention, so expanding prevention efforts such as condom use, hepatitis B vaccination, PrEP for HIV, TB preventive treatment, for example, and to enhance testing. All the approaches that we have in the toolbox, we need to expand on them and scale them up. Innovative approaches to testing, home testing, outreach and integrated testing into primary care and emergency care, for example, and improve on the treatment and the successful completion of treatment. We also need to, of course, try and fill the data gaps and improve the data and monitoring of it. And specifically, since these diseases are affecting key populations or vulnerable populations more than others, we need to focus on getting data on those as well in order to reach the SDGs and leaving no one behind.
I look forward to speaking to you again next year to see how we've done over this next year.
Hopefully an improvement by then. Yeah.
Thank you very much for your time today, Charlotte.
Thank you.
We hope you enjoyed this episode of ECDC On Air on the 2030 Sustainable Development Goals and now understand the work that ECDC does to help achieve them. If you would like to know more about the SDGs, please see the links in the notes of this episode. If you would like to know more about ECDC in general, please visit ecdc.europa.eu or follow us on social media. If you enjoy this podcast, give us a like or a follow on the platform of your choice, and don't forget to leave a comment or review.